tell you a little bit about Papyrus first of all, if you don't know who we are. We're the UK charity that's dedicated to the prevention of young suicide, and we work with young people who are under the age of 35 and are experiencing those thoughts of suicide, and people who are worried about them, and we also offer a debriefing service to professionals. So if we just move on to the next slide, please, Penny. Thank you. Fab. So you can see there some of the ways in which that we work with individuals are to support, equip and influence. So in terms of our support services, we run a helpline called Helpline UK, and that's a service that runs 7 days a week, 365 days a year, and it's available to all of those individual categories that I spoke to previously. We also equip our communities, and that's through offering training. We also offer a number of resources, and you can see there on your screen that we have a schools and colleges guide, and that's downloadable. We also have recently launched an information booklet for parents in particular, specifically around self-harm and suicide. The third thing that we do is to influence, and that's to come here and speak to people like yourselves and let them know about the work that we're doing, and also to participate in government, with government conversations, with research, and it's just to make sure that the voices that we're hearing through our communities are heard within that particular setting. So Penny's just going to bring the next screen onto us now to look at our recent suicide statistics. So if you look there, some of this data will unfortunately be very familiar to you. So you'll see there that in 2019 there were 5,316 deaths through suicide. And that question, why young suicide, might be pertinent to some of you. So if we move on to the next slide, we can just see the statistics that are broken down for the age group that we work with. So the number of young suicides between the ages of 10 and 34, the age group that we work with, were 1,516. In 2018, that number was 1,380. So consistently, there is a growing number of young people who are taking their lives through suicide. And equally, we can see that the total number of suicides, there's roughly about 29% of the total number of suicides are from young people, which is why we need to specifically concentrate from Papyrus's perspective about some of the issues that are happening with our younger generation, and start to tackle that immediately, and to look at that early intervention and prevention so that we don't see this number increasing year on year. Unfortunately, these statistics come from the Office of National Statistics, so we don't have any recent data from ONS, but most recently there has been an NHS study that was published between March and June of this year. That's where the data came from, and within that study it was utilising the National Child Mortality Database, so for children under the age of 18, and unfortunately we've started to see a potential increase in the number of suicides again in this age category just for this particular year. We're unsure about the effects of COVID on that particular period of time, because as I said, we've started to see an increase throughout the years. It's the only age category that has continued to grow. However, it's something to bear in mind during our COVID discussions for today. So Penny, I'm just going to talk to the next slide, and within that I just wanted to share some of the themes that were coming up through our helplines, through our communities and our interactions with young people. We call these contributory factors, and some of these may be familiar to you in your services. I know that when I participated in some of the NSPA conversations, some of these themes were relevant, but I thought it would be helpful for us just to have a quick talk through what that means from Papyrus's perspective. So through our communities, we are starting to hear that there are a number of issues for young people around isolation, as we've discussed previously, but more specifically isolation in terms of their identity. So that could be that they are away from their particular communities. So whether you identify as LGBTQIA+, you're away from that particular community because you were isolated, physically away from individuals. We also had some of our BAME communities contacting us as well, well, talking about how they felt that they couldn't access some services in particular, and again that they were away from their own particular communities. For some children and young people, a big focus of that community were their schools and colleges. As Penny spoke to earlier, sometimes school was actually a negative place for those young people, so lockdown proved to be a positive, but for others it kept them away from growing in their own interests, from being able to connect to their peers, and that was a real challenge for them. And I think one of the things that we came through was about family issues. Suddenly people that had space and place to go and explore themselves didn't have that any longer. So there was a real lack of privacy for people. And I'm sure, as all of us can appreciate, when we've been trying to work, when dogs are coming in, or children or cats are jumping on our laptops, it's incredibly difficult for people. So those family day pressures, those day-to-day pressures for people have really increased during this particular time during lockdown. And all of these contributory factors have contributed to individuals' thoughts of suicide. Again, I spoke to relationships there, and some of the relationships, as I said, are friendships. It could be the relationship that you have with your teacher or your football coach, or it's not being able to see other members of your family perhaps that you got on with. For some individuals, it's about not being able to see a partner, young parents that haven't been able to access their regular support networks, mental health groups, for example, not running in the same way. So people really losing those relationships that connected to them, and potentially their self-care as well, which we found to be really interesting to look at. And again, unfortunately, sometimes within those relationships, we have seen an escalation in abuse, whether that's physical, sexual, or emotional. We have started to see that. And again, because we're in that concentrated environment, and with particular people being at home, there is no escape for some people within those situations. And with that, we've seen, as I'm sure many of you experienced, an increase people talking to us around their own mental health. So whether that's anxiety, depression, we've particularly seen in young women, people who are experiencing BPD, which is incredibly complex, for people to manage anyway. However, I think when we're looking at mental health services in general, but particularly during lockdown, their ability to access support has been significantly reduced, whether that's because people are unsure of referral pathways, school potentially has been there to refer people, and that hasn't been an option for individuals. Equally, individuals have not been able to approach their peers around that, as we mentioned previously, in terms of that support. Professor Lewis Appleby again spoke to you very recently about the complexities of mental health, particularly when individuals are experiencing thoughts of suicide. It isn't actually noted as a mental health condition or a mental. So for that purpose, it's very difficult sometimes for people to know where to go to access a particular service. So for one of those reasons, again, accessing support has been really challenging. I think a lot of people have assumed that young people have access to technology, so have tried to bring things online. We're all very fortunate that we're here today being able to do this webinar. However, young people, particularly in rural areas, may not have a good Wi-Fi connection, so haven't been able to access support. We equally know that individuals may be experiencing digital poverty, so may not have access to laptops where they need to do an interaction like this. They may not have the appropriate software on a phone, for example. So it's really challenging to get that support. And equally, we found that young people again have experienced a lack of privacy. So even when people have been able to offer support, young people have felt that they've not been able to take on it, whether that's because they didn't want their family to know that they're accessing that support, whether they didn't want their neighbour to know that they were, with somebody coming to have a chat on the front lawn when we could do that in some of our tiered areas, really not wanting to access that support at that time as well. I know in Papyrus we've seen a particular increase in the number of text and emails that we've received in comparison to our calls, and again we attribute that to that lack of privacy potentially that young people have not been able to access. We've also seen young people who have been concerned about other young people as well. So recently, when students have gone back to university, we've taken several calls from some other students who have not known individuals, and that's really challenging as well, because you've gone to a new environment, you don't know people, you don't know where to get that support. But there have been some individuals who've contacted us to say, I'm really worried about this person, I don't really know them, but what we've been able to do is to direct them to that particular layer of support, whether that be to Samaritans, to ourselves, to COOD, to whoever it is that's most appropriate in that moment for that individual. But again, we've got a lot of isolation going on that's contributing to all of this, all of these sorts of suicide. And I think what we're starting to see as well, a shift in some of those trends that I think some of my other peers will speak to in a moment. So finally, if we just move on to the last slide, Penny. Suicide is really complex. It involves multiple people at multiple times and often contributes towards multiple issues. I spoke to you then in regards to the mental health services. 60% of young people, and even more at times, are not known to those mental health services. So what we're trying to do at Papyrus are to empower others like that young person at university to say the S word, to ask people around their thoughts of suicide, to be concerned, and to ensure that we are supporting our communities to become suicide safer. So thank you very much for listening to me today.